The $551,000 plus that I announced here today for the Atikokan General Hospital is to help the hospital meet some of their more pressing infrastructure needs, as Jennifer has indicated in her presentation. There's some much needed repairs in the hospital, and that's exactly what this funding is designed for, is to help help our hospitals meet those infrastructure improvements and repairs. The hospital is almost 50 years old, so with a 50-year-old facility comes the need for reinvestment into the infrastructure, and our government is committed to helping the hospital achieve that.
It's clear from the slideshow that it's much needed, and it was clearly greatly appreciated.
Yeah.
I heard you mention afterwards there that kind of the status quo hasn't really been working, and it's been nice to get away from that. Could you elaborate on some of the changes that might be coming ahead that you'd like to see, where kind of that infrastructure problem might find a solution?
Sure. We've seen an inadequate level of funding in our healthcare system over the last decade and a half, and which has resulted in facilities not meeting the current needs in the healthcare system. Our government is making record investments into building, revitalizing, and improving hospitals all across the province, and this is another example of how we're doing that work. Moving forward, we know that the status quo, as you indicated, wasn't working, and that we needed to be investing in our healthcare system at a level higher than what we had been experiencing. And we are making those commitments and making those investments to meet the needs of our residents across the province.
And is there are there any services in particular that you could see requiring or benefiting from these funding initiatives in the future in Atikokan?
So in Atikokan, specifically with regards to the infrastructure funding, I'm going to be continuing the conversation with the CEO of the hospital here and getting a good understanding as to what their infrastructure needs are moving forward. But aside from that, I want to have that more fulsome discussion with her about what are the overall needs of the hospital, what other areas are we looking to need to look at providing some assistance to, and to make sure that the programs that are designed to help the hospitals are being applied here and available to the Atikokan hospitals.
Earlier you said you also stayed in this hospital before.
Briefly.
The thing is, you had some really kind words to say about your stay here. Being the MPP for this region, being from this area, how important are these rural hospitals to the Northwest?
Absolutely. So one of the biggest challenges, and I say this often in my role as an MPP from Thunder Bay Atikokan, but more particularly from Northwestern Ontario, is making sure that the circumstances that exist in Northwestern Ontario are understood at Queen's Park. It's a different system here. Even our funding arrangements are different. The vast geographical areas between our communities is something that's not experienced as greatly in the more populated area in Southern Ontario. So the rural hospitals, as you called it, by example, Atikokan, is serving a region that would be severely underserviced and would be hours away from medical care. So it's not just the town of Atikokan that this hospital serves, but it's the cottage country or the camps that are in the area of Atikokan. And as you referred to, that's the opportunity I had. I was at camp. I had an allergic reaction to a bee sting, and Atikokan Hospital was the closest facility. As it turned out, it made a difference for me. When I got here, I was having trouble breathing. So the service here that they provided to me was fantastic, and it just speaks to the small rural hospitals and the level of care that they provide is second to none. So other family members have had opportunity, unfortunately, to have to utilize the services here in Atikokan, and they've always been professional and very caring care that they provided. So in Northwestern Ontario, these hospitals and these centers are vital for people because of the distance they have to travel to larger regional centers. So.
Which is why this significant amount of funding going to make sure that they're upgraded properly, up to standard, is very important.
Yeah. So last year we announced funding that will help them with the installation of the sprinkler system into the hospital, which is mandatory by 2025 or 2026, I believe. So, we recognize that hospitals like this needed the assistance in providing that. We provided that. But we also knew there was a longer list of infrastructure improvement and rehabilitation needs of the hospital, and we were making that commitment to help them achieve those infrastructure needs. So.
Could you tell us what this funding announcement means to the hospital and how you feel being on the receiving end here?
It's a fantastic news. Every penny is watched here, and to be able to put money towards the sewer system, and it doesn't sound like a lot, but it really means a lot to us. We had a big upgrade of our HVAC, and now we want to upgrade our sewer system and our electrical panel. I had no idea, I'm new in this job, and when the maintenance came and talked to me about they're having to get the electrician to find old parts from old electrical panels in order to replace what we have that breaks, and that's terrible. So we need to upgrade our electrical panel, we need our lights, and our power, and the sewage system needs to be replaced too. It's a scary thing to see. You saw the pictures of the pipes. Yeah, they're in rough shape, so it means a lot to us. Especially, we are watching every penny. Our HR dollars are crazy trying to staff, and so just to have this relief of not having to worry about where we're going to put that money is fantastic.
It's understandable, especially reliability and sanitation are kind of two of the most important things.
What do we do if the hospital shuts down? Where do we put people? Where do we go? We have to start thinking about that. It's crazy.
Yeah, absolutely, and it's got to be nice to actually have to kind of divert from the typical workday and to come down here and get this kind of big news, right?
It's fantastic. It's really been a big boon for us. It's been stressful. It's been a few stressful months trying to figure out how we pay for things, and just to have an announcement to say we're going to support you. And like I said before, the support that we're getting from the ministry is incredible. I feel it's incredible. So this is just one more way that they are supporting our small hospital. And we are a small hospital. We are very isolated. But when you think about maybe possibly having to close your ER doors because we're 2 hours away from Thunder Bay, it's a very scary thing. So this has helped tremendously. It's put a smile on people's faces.
Certainly can't wait 2 hours during an anaphylactic shock, right?
No, where would you go? That's really, what would you do? And that is the reality of when you live so far away. We are 2 hours from Thunder Bay and an hour and a half from Fort Francis, and we have one ambulance service. So the ambulance is out of town, which it goes to Lac La Croix or wherever it's going. We don't have an ambulance service for 4 hours. What do we do if somebody's having an anaphylactic reaction and our ER is closed? Where do we go? So it's a scary thing.
Here's hoping for more ministry support down the line.
Speaking of ministry support, and that's the thing that we were talking about, right? There's a great deal of collaboration between yourself and your MPPs and everything that you're going back. During the funding application process, is that process fairly easy to go through? Is there just a lot of...
No, actually, I've done it before in a weird way, but yes, it's not a hard process at all. We used to get not a great deal of money, and we would figure out how we would work that. It used to be around $90,000, I think we used to sort of anticipate we would get, and now with this money, it's just, last year was $729,000 or something, and this year it's so much. It's just really been, you can tell that the ministry is responding to the needs of hospitals, especially small hospitals. It's been fantastic for us, and it's not a difficult process.
And what's next for the hospital after this point? You get the sewer systems in, upgrade electrical. Is there any more projects that need?
Yes, fortunately. Our HVAC system for our service wing in here, we've got costing on that. Because again, it's where all of our kitchen and our housekeeping and our ER, our HVAC system is 45 years old. It needs to be looked at. So we're looking at talking to the board about how we're going to afford this. That's what's on the list.
What is your average number of patients that comes through, maybe yearly?
So we get around 4,000 people coming through our emerge, and then we're we're not always full. Our hospital is about 60% full, and a lot of our patients we treat in the emerge and fly out. We have Orange, we're heavily reliant on Orange, and they fly out to Thunder Bay. And that's been a great collaboration also. They have a transfer nurse in Thunder Bay that takes patients that are going for CT scans, MRIs. We don't have that here. Doctors really rely on CT scans, so there's a lot
We
of.
heard a funding announcement here from our MP, and yeah, big news. What does it mean to the community?
Oh, we're always looking. There's infrastructure issues are so important. But it's kind of behind the scenes because everybody wants to see something shiny and something new. But you have to do the infrastructure before you could do the roads, before you could do any other building. You got to make sure that the foundation is solid. So it's very important for the hospital to have that solid infrastructure. And we talked about the sprinkler system. We talked about the HVAC. We talked about the electrical. So those are the bones of things that you have to get before you can do the other nice to do things.
Yeah, it's the pragmatic approach for sure, right? And when it comes down to it, a hospital should be about pragmatism, right?
That's right. Yeah, you want to make sure that it's safe for the patients and safe for the employees too. So we want to make sure that we're doing what we can. And energy efficiency, there's all those different areas that this is going to cover it and make things better.
And so many benefits that the hospital provides the community, right? It's always good to see that funding.
Yeah, it's a community hub, of course, and it's something that we take for granted having a hospital because we've always had a hospital here in Atikokan. But as we discussed earlier, it's just not Atikokan; it's the region that we service as well. And when you want to grow the community, that's one of the things that people are asking for. You know, what's the healthcare system like? And I think we have a pretty good, pretty robust healthcare system for the town of our size. And we can't do everything. I know obviously you can't do everything in a town of this size, but we do the basic care and we're always open. They've done a great job at the hospital keeping the emergency open. It's an issue in Ontario, across Canada, I guess, but we've done a great job on keeping here. They've done a great job on keeping the emergency ward open. And again, that's a community. It's a community hub, and we want to grow the community. We're going to have, I think I heard you mention that, there's going to be more construction, there's going to be more things going on, and those are services that we have to provide too. So as we want to grow our community, we got to maintain the facility that we have.
And the hospital. How instrumental has Kevin been in getting this funding here and putting a show, shining a spotlight on some of the issues that are happening?
Yeah, well, that's great. And I know when COVID hit, things changed, and we didn't see our local MPP as often as we would have liked to, and really we were on the wrong side of the aisle at that time. So having Kevin as a member of the majority of the PC government is a big help to us. And Kevin is a small town guy, so he understands how Atikokan is. He lives in Conwy, so he comes to the big town here for a visit there. It's like him going to the city here for us. So we appreciate him coming here, and he understands, as being a mayor for 30 plus years, he understands what I'm going through and what the town is going through. So he offers me a lot of great advice, and we've been getting a lot of support from the Conservative government. So we're very appreciative of that.